Hey, what's going on, guys? This is JC, the Bald Hearing Guy, and I'm starting 2025 with an insurance story. So, we knew as providers at the end of 2024 that things were going to change. We've caught some wind saying, hey, some benefits are coming down. Patients would come into the office and say, hey, we know the benefits coming down. A lot of people are rushing in trying to use their benefit by the end of the year, but we don't really know what that means until the new year, like until we get those benefits in, unless we get a book and we start looking at, like insurance providers, seeing what those benefits are and who has time to do that. So today I saw my first patient. I won't say the insurance company's name, but they're a dually eligible patient, meaning they have Medicare and they also qualify for Florida Medicaid. So normally to qualify for Medicaid, it's either income or disability, or I'm sure there's other scenarios, but for the most part, there's an income restriction. They're at a certain level. It's probably the poverty line or below, and then Medicaid kicks in to help with their healthcare expenses. Medicare does not cover hearing aids, but Medicaid, those that have dually eligible plans, usually they get hearing aids covered. And there's one plan that I have been saying for the last few years has been my favorite, and that's the plan that's changed now. I don't know if I can or should or legally where I can go when mentioning these insurance companies' plans, so I'm playing it safe here. But so the patient comes in, she's gotten hearing aids year over year, which is a whole other subject, whole other thing of whether that's considered, an expense to the insurance that they should be paying or not, because we kind of see it as like that could be fraud and wasteful, but that's the only way they'll pay for services. Anyways, let's come back. I go on tangents. Let's digress. She comes in this year. Her benefit has almost halved. And here's what that means, right? Like she's coming in, she's getting her test, she's ready to get some new hearing aids. She wants to hear better. The hearing aids that are now covered are significantly lower in technology than they used to be in the last 2 years. Now she has the option to purchase better. The patient has the choice to say, you know what, I don't want that one to a certain degree, I'm going to buy this one. The problem is that these people usually they've had an income qualification to get Medicaid. So they don't have a lot of disposable income, right? And normally I'm the guy that's saying, it makes sense to get the better thing. If you're buying a TV, if you're buying a laptop, if you're buying your hearing aids, if you're buying with a lot of, let's say, tech, at the end of the day, there's some tech here. You do get better technology when you're going up the chain. Anyways, these people can't normally afford them. And that was this patient's case. She's like, I can't pay for this. And so we're moving forward with hearing aids that means next Thanksgiving, next Christmas, next get together, she's going to be at a disadvantage versus last year because the hearing aids are no longer as good. So it's kind of mind blowing, and I'm going to see, we'll see as the year progresses how this translates to our Medicare Advantage plans. This is a tough thing as a provider too, because what this means is for many of us, it's been a decision of, do we participate with these plans or not? And there is I'd say it's very, very common to see established providers like myself to start to elect to opt out, because we start doing math and going, hey, it literally costs us so much time and money, resources to see these people, and what we're receiving as reimbursements usually are abysmal. You do it because that's where you're going to see that child that has a Medicaid plan. That's where you're going to see these seniors that you're connected to year over year, that they won't be able to afford the hearing aids otherwise. So by saying you're not going to get these, you're not going to see these patients, or you're not going to see these plans, you're saying I'm not seeing these patients too. And that's a tough one, but math is math, and we do have to support our families, pay our bills. Bills have gone up, hearing aids have gone up, cost of goods have gone up, rent has gone up. I mean, all those things that you guys feel, we feel. We're human beings and we're running a business too. Like you can make a good living, but at the end of the day, we support our families on this. And when all these plans keep coming down and down and down, we got to do that math and go, hey, is this worth it for us? Like, does it make more sense to just see the patients that are going to be purchasing them out of pocket? Whole other subject for another day, maybe a good podcast episode. But 2025 is off to a rocky start with health insurance. I'll report a little bit more. If you guys know someone or are dually eligible Medicare, Medicaid, look at last year's benefit, look at this year's benefit. You guys do have the chance to elect another plan, partner with an insurance specialist to find out, hey, who's paying more for what? Whether it's your prescription drug medication, hearing aids, I can't tell you what to do. Legally, I can just see the person that can legally advise you, and that's most likely an insurance agent, not myself. But have a good one, guys.